The next part that comes within this section would be this allergy and clinical immunology. Here we have like allergy doctors, allergists as a separate specialty, and we have various sets of codes for this. We all know, like, being a patient having a hypersensitivity reaction, and they want to determine for which antigen the patient is exactly allergic to, whether is it to the dog's hair or the cat's hair or to pollen or to certain seeds. To assess that, the allergists usually they administer a battery of tests. Okay, so we have so much of intracutaneous test, we have percutaneous tests and intradermal tests. So what happens, this usually comes as a battery. The device might contain so much of like 60 units of antigens or like 90 units of antigens, and they just keep it on the patient's back, and they would ask him to see if there has been any allergic response or a hypersensitivity reaction. Okay, this is usually done with the patch testing. So they apply like 60 patches, 80 patches, 90 patches. Accordingly, you can bill for the CPT codes. On day one, the physician will be applying these patches, and he would be asking the patient to return on the third day to see if there is any hypersensitivity reaction. Perhaps there is a wheal and flare reaction. Wheal means edema, flare meaning redness. So if there is any erythematous or any kind of allergic reaction around this antigenic extract, or what happens is you can suspect that this patient has allergic to this particular antigen, and accordingly the treatment protocol will be established by the allergist. So if there is negative, then we say it's a patient is negative to this particular antigenic stimulation. So we have like photo test where they'll be passing this ultraviolet radiation and see if the patient is allergic. So you will have to bill for the number of units. So determine the number of tests and determine the type of test in the first place, and then the number of units that should be administered.